Hi, welcome back to my channel. For those of you who are joining me for the first time, my name is Dr. Golda, and I like to make videos on health issues and things that are important to me. Short videos, of course. Today's video is on the Canadian healthcare system and the decline of the Canadian healthcare system. Well, let's do a brief history lesson. Canada has been historically seen as one of the best countries in the world in terms of healthcare provision. The Canadian healthcare system was one of the models of what a healthcare system should look like. So what happened? Well, there have been some challenges in the past couple of years, or I'd say decades, in the sense that the healthcare system is not able to meet up with the demands placed on it. Some of the demands that are being placed on the healthcare system in recent decades has been, number one, there has been a steady rise on the use of new technologies and technological advancements to provide and ensure that we're able to provide better care to our population. For example, MRI machines and the latest technologies to diagnose and to treat patients or those who are seeking medical intervention. With these new technologies comes a higher price tag. And this is where the problem lies, because the federal government funding for the provinces and territories has not really steadily met up with the rising costs. So whereby, provinces and territories were able to provide great care in the past because, their interventions or treatments and technologies were less costly. Now it's kind of a challenge because, the funding that they're receiving does not really help them to provide maximum benefit. The second issue is that, I would say this is not an issue. The second challenge that the healthcare system is having, that we have an aging population, which is great because the whole point of the healthcare system is to prolong life where possible, to make sure that people are able to live good and healthy lives into old age. And that is the goal of the healthcare system and the public healthcare system. However, the government funding has not, again, recognized that this is something that they need to focus on in terms of the fiscal initiative, the federal purse. Governments should increase, the federal government in this case, the amount of funding for provinces and territories because Canada has an aging population and our seniors and elderly need to continue to have good quality of life and great medical care, irrespective of how old they are or where they live. Another issue that the healthcare system has been faced with is rising wait times. We've heard in the news and read stories of people that waited for months and years for medical intervention, and there were some people who were not able to readily access it and on time. So again, this is another issue, fiscal issue, that not enough funding to make sure there are enough hospital beds, to make sure that hospitals and healthcare service facilities are able to provide and hire more healthcare practitioners. And finally, I would say the focus on the curative medicine versus preventive medicine has contributed largely to this discrepancy. We have, for example, most physicians are trained in providing curative services as opposed to providing preventative services. Why does this distinction matter? Well, it matters because if we're able to prevent diseases, and there are a lot of diseases that can be prevented or reversed just by making different or changes to, let's say, diet, exercise, and so on, we'll see less of a toll on the healthcare system. I hope this helps you and provides you with a better understanding of why, for example, wait times are very long in emergency units or hospitals or the emergency sector, as well as for surgeries and so on and so forth. If you're enjoying my videos, please make sure to like, share, and subscribe. And I'll see you on the next video where I talk about red dye 3 and what are some of the health implications of the consumption and the usage of red dye 3. Thank you so much. Bye.